Hey again, it's me, your gym senpai. Anyway, so I have noticed when I first started filming, I got a lot of people asking about my wall of supplements back here. Do supplements work? What about all these supplements in your back wall here? So the unfortunate answer to that is those supplements don't really do much of anything, and most of them have not been sufficiently tested for efficacy, reliability, and safety, with some exception. Most people probably don't get enough omega-3 fatty acids in their diet, and so one way to get fish oil supplements. Those people eat way too much omega-6 in their diet, so you could limit some of that and replace that with omega-3s. You could be a little bit healthier, who knows? I personally consume a great deal of supplements. However, a lot of these supplements are to give me an additional pump at the gym because it feels really good, but it doesn't really do anything else. Those are nitric oxide inducers, things like L-citrulline or L-arginine. Arginine is actually an amino acid that's naturally occurring. That said, taking it in high doses is not necessarily safe for everyone. It can change your blood pressure. Also, if you're someone that just stays inside all the time and you never get any direct sunlight exposure, probably don't have enough vitamin D synthesis. Vitamin D is a crucial, well, they call it a vitamin, but it acts a little bit more like a hormone. It's very crucial in a lot of metabolic processes throughout your entire body, and hormonal ones as well. If you're not getting sufficient vitamin D, that is something that some people lack. If you're worried that you might be deficient in something, you can always get blood labs done from the doctor, and then that can show you whether or not you need something. Of course, listen to your doctor. If your doctor says that you should go get a supplement, then go get it. Otherwise, you're probably wasting your money. For those of you that stuck around for the entirety of this video, you get a little special treat, because one of them, one supplement in particular, does work very well. It has been tested and tested again to the point where it used to be just simply a correlation between the use of creatine monohydrate and strength gains, muscle size gains, etc. But now we know that there is a cause-effect relationship. Clinical dose is 5 grams per day. Now, with creatine monohydrate use, you will become heavier. However, that's simply because the body is storing that creatine, and with that creatine, pulls water into your skeletal muscles. So you will be stronger over time. So yes, it does work. Now, I wouldn't expect to change into a bodybuilder physique overnight. On its own, it doesn't really do much. If you're doing the hypertrophy training correctly and you've got your diet dialed in, creatine monohydrate will help a lot with that. Pretty much everything else, maybe some people are deficient in magnesium, but that's only maybe like 20% of the American population. If you take too much magnesium, you'll know you'll be using the bathroom a lot. Other than that, even things like electrolyte drinks are fucking scams. To get some electrolytes, go eat a meal. Like, that has all the electrolytes that you need. Sodium and chloride? Anyone? Anyway, that's all I wanted to talk about supplements. I don't really have any specific brands in mind because I can't vouch for any of their specific safety and efficacy. But just go get like some regular old creatine monohydrate. That should do you trick.